My name is Ankit Gupta. I am from Siemens Healthineers. I am the co-lead of the work package 2, which is titled as Data and Models, which covers data sciences and data governance topics.
My name is Jonas Radermacherx. I'm a biomedical data scientist and PhD student, and I work for Fraunhofer Sky.
I am Kostas Georgiadis. I am a postdoctoral research associate at CERTH, working on EEG-based brain-computer interfaces and brain network analysis.
So my name is Holger Fröhlich. I'm heading the Department of Biomedical AI and Data Science at the Fraunhofer Sky, and at the same time, I am professor for biomedical data science at the University of Bonn. AI is used mainly to accomplish one of the main missions of predictome, so namely to come up with a stage-wise risk assessment for individual patients. So these models are actually meant to provide an assessment of for either existing cognitive impairment or the risk of the future development of such a cognitive impairment based on a number of different factors or features that these models integrate.
There's a lot of literature on known dementia risk factors, including demographics like age and sex, medical risk, including history of hypertension or diabetes, a family history of dementia, or even lifestyle factors such as smoking or physical activity. And we have developed a model that combines many of these features to predict the risk of developing dementia up to 15 years in advance.
We use EEG to record the brain's electrical activity in a non-invasive way and analyze how different brain regions interact. By modeling brain networks, we can map these interactions and identify patterns of altered or disrupted connectivity that are typically linked to cognitive impairment. Consequently, the changes detected can act as early indicators of conditions like Alzheimer's disease. AI supports this brain network modeling process by helping us analyze complex EEG data, automatically extracting meaningful features and detecting subtle connectivity patterns. This way, we can better characterize disruptions and estimate more accurately and efficiently individuals' positions along the Alzheimer's disease spectrum, ranging from healthy aging to more advanced stages.
So for us, it's mainly two things. Does it work beyond the data it is trained on? And can we really explain it? So for reliability, we do strong external validation. And for fairness, we check for bias across demographic groups and also use explainable AI to keep things transparent and trustworthy. So honestly, if you can't explain it, it's really hard to trust it, especially in healthcare. So it's not just enough for a model to be right. We really need to understand why. Now, doctors need to understand the reason behind a prediction, really to use it confidently. It also helps in the adoption part of it because people are much more comfortable using something that they can really actually interpret.
The input of our model can be given by a simple questionnaire. This model can be used at home and for population level screening. And in return, somebody who is then identified with elevated risk could be referred to a specialist for further testing.
So basically what's the idea behind this stage-wise risk stratification approach is that we are at the end able to earlier diagnose the disease if there is actually a disease, or plan also maybe for those who may at the moment be at a particular risk but not yet diagnosable with a certain cognitive impairment, the frequency of follow-up visits.